My name is Kyla Ehrenreich, and I'm a physician assistant, and I'm the associate medical director at West County Health Centers at the Gravenstein site. So at West County Health Center, we offer a variety of amazing programs for our patients. We have our primary care sites. We have 3 separate primary care sites that serve patients across West County. So we have a primary care site in Sebastopol, in Occidental, and in Guerneville. And then in addition to that, we offer a lot of other amazing services for our patients. We have a whole wellness department where we offer one-on-one consultations with alternative practitioners such as herbalists, naturopaths. We have acupuncture, amongst many other really great services. And then we also do group medical visits for our patients. And that we have a variety of those as well, including physical therapy. We do other movement-based groups like Qigong and Tai Chi. We also have group medical visits that focus on nutrition and metabolic health, to name just a few. We have a lot of other options as well. In addition to our wellness department, we have a youth service program, and that includes an actual clinic for young people to come in and get all sorts of services related to family planning, and then we offer medical clinics at the on-site at some of the schools, including Annalee and the Guerneville School. And what am I missing here? We have a program called Healthcare for the Homeless in Russian River, or in Guerneville, and we have dental clinics both in Sebastopol and in Guerneville, and we have perinatal services for pregnant patients. And we also have a gender service program for people looking for those services. HIV services, and we do a lot of substance use support as well. Our current number of patients that we serve is around 10,500 patients, and people come from all over to access our services, but typically folks come from West Sonoma County. We accept all insurances besides Kaiser, so that includes, we try to prioritize our services for patients who have Medicaid or Medicaid Partnership Health Plan, but we're also open to people who have private insurance as well. In the current model of healthcare, the way that we get paid is by, and the way that we thrive as an organization is by getting reimbursements from insurance, and that requires our providers to see a lot of patients in order to cover all the costs of everything that we do with our staff and all the programming that we do. And so we're always looking for ways to expand our services, and what that means is we need to be able to financially support that. And so relying on grants and other donations from outside of from community organizations is something that we always appreciated as well. Yeah. A few years ago, our wellness center in Forestville had a fire, and the building was no longer usable after that. And so all of the services that we provided that I listed had to be we obviously wanted to continue doing that, but we needed to find space to do that. And so we sort of managed, but it's not ideal. And so we are in the process of trying to rebuild that facility in Forestville. And that, has its expenses, of course. And so looking to the community for supporting that is one of the biggest challenges, especially in the way that we want to do it to make it really a valuable service for our patients. We're thinking about having a demonstration kitchen in there so we can help people learn to cook healthily. We are hoping to have to have space for group-based programs, for movement classes. So that's one of the biggest projects that we're working on right now. I think, honestly, almost every single day, I think about how much the work I do matters to me. My interactions with the people I work with, the patients I encounter on a daily basis. I'm lucky in that the work that I do, I get that feedback pretty directly from patients and coworkers, and yeah, my heart is in it. Like I know that I've found the type of work that I really enjoy doing and want to continue doing, especially in the community where I work. Everybody deserves access to healthcare, period. And community-based healthcare, in the context that I've seen it, is unique in that we don't just kind of stop within the four walls of our clinic, but we really do look to our outer community to support the work that we're doing and the services that we provide for our patients. I'm excited to be collaborating with Community Market. I think that there are a lot of really interesting opportunities where we could work together in the future, whether that's having patients come here to do tours with one of our nutritionists to learn about nutritional value of food. I mean, food truly is medicine, as we know, and from my own experience shopping here, I know that there's an emphasis on healthy eating and also supporting our local vendors to sell their products here. And I just think that there's the more that we can sort of go local and make it affordable for everybody and accessible for everybody, the better off everyone is.